coming after those predators.
Governor Abbott promises new steps to fight sexual predators. We'll look at what he's offering up, how it could help, and what could stand in the way. Hello, and thank you for joining us for State of Texas. I'm Josh Hinkle. Texas Governor Greg Abbott on Tuesday announced a set of policy proposals to strengthen reporting protocols for sexual harassment in the workplace. One part of the plan targets allegations of misconduct by lawmakers at the Capitol. The governor's plan would put the Texas Rangers in charge of those criminal investigations.
Putting these claims in the hands of the Texas Rangers will ensure that allegations of sexual misconduct and harassment are fairly and thoroughly investigated.
The governor made the announcement at a news conference in Houston. He was joined by families who have been affected by sex crimes. The plan includes proposals to enhance penalties for human traffickers and provide funding to create squads to investigate trafficking. The governor also pledged to provide $14 million to eliminate the backlog of untested sexual assault evidence kits. His proposals would also add new measures to crack down on inappropriate relationships between teachers and students.
To better protect our students from this ongoing abuse by school employees, I want Texas to create a do not hire registry of educators and other adults who have been barred or who should be barred from school employment due to teacher-student predatory relationships.
The governor's proposals build on the work of lawmakers in the past session, and among them is Representative Tony Dale. Thank you for joining us.
Thank you.
So you just heard the governor right there. How do you think that issue is really going?
Well, I'm very pleased to hear the governor wants to take another crack at doing this do not hire registry. We filed a bill on that last session, and we knew it was important because it wasn't just teachers in some circumstances that were having inappropriate relationships with students, but it was non-certified teachers as well. And in one case, it was a school resource officer, a police officer in the Houston area, and sometimes it's janitors and other folks. So it's important that we're not moving these people from school to school, and sometimes they move from the public system into the private system, and this registry would allow private schools to access that list and make sure that they're hiring people that are not going to prey on children.
Yeah, I mean, right now it's kind of hard to track. Why was this something that you decided you wanted to tackle? Did constituents come to you?
Well, you know, I represent two school districts, Leander ISD and Round Rock ISD, and sadly, both of them have had circumstances where teachers have had inappropriate relationships with students. And so it's a problem locally for me. It's a problem all over the state of Texas and unfortunately throughout the entire country. And it's just not appropriate for people to be moved from one place to another and have this kind of information covered up. We just can't have these people around kids.
With this topic and specifically with no hire databases, you know, what is the obstacle to getting this done?
Well, one of the challenges that we had was there were issues of due process, which I think are appropriate to talk about. You want to make sure that it's not simply someone that was accused, but someone that, you know, was determined they were actually guilty of a crime against a child to be put on that list. And we had to compile the data, and we were trying to work out the differences between certified people, which should already be covered in the sense that if a certified teacher has this sort of inappropriate relationship, the education system is aware of that now, and they're not going to be hired at another school. But we really need to take care of these other teachers. Today, a lot of teachers don't have to necessarily be certified because we're changing the rules to allow people to come in to teach that maybe have certain skills that would be beneficial, but they're not covered by the current law.
You know, so many of these proposals, stopping human trafficking, testing rape kits, creating a database for educators who prey on children, they have a lot of support, but they come with a price tag.
Yeah, so when we tried to do this registry last session, we were told that it was going to cost over $1 million over 2 years. I always question when I hear those kind of amounts. They're not my numbers, but certainly there would be a cost to put it together, and there's some cost to maintain it. Whether it's that high, I'm not quite sure, but at the same time, there's a cost to it. But then you've got to ask yourself, at what cost do we allow people to continue to have contact with children that they shouldn't? I think it's a worthy investment for the state of Texas.
As we've been investigating the state's tollway system, you've been very passionate about talking about text tag and the problems they've been having with billing. The House Transportation Committee finally had its first meeting this past week in between the two sessions to start possibly tackling this issue. How do you think that progress is playing out?
Well, I think we are making progress. We've been working closely with TxDOT. We've been talking to pretty much everyone that's involved in this whole system of toll tags and toll roads and billing and all the technology that's involved with it. And it's more complicated than one might think, but at the same time, it's pretty straightforward that what drivers on roads want is that if it says it's 55 cents, they want to be charged 55 cents and not 56 cents and not $1,000 or not some outrageous amount. So we're trying to make efforts in the legislature to reduce the outrageous fines that occur, but at the same time, we've got to really improve those back office operations so that it's not only accurate, but when a customer calls for service, they're getting good customer service and being treated properly. And we continue to put emphasis on that, and I'm hopeful we're going to make good progress.
So you've got a campaign in the midst, elections coming up down the road. What's your other priorities? Because you want to be back in the legislature again next year.
Well, some of my priorities for the next sessions, well, really it revolves a lot around these toll road issues. I live in a district that's quite small geographically, and there's only 2 highways that run through it. They're both toll roads, both owned by different agencies. I'm trying to work to get non-tolled access roads along 183A in the Cedar Park area, which I think would be very beneficial for people, especially in Leander, that are commuting downtown to work. It's very costly to take that road every day. And been working with local leaders on that, so that's a big thing. But we already had on our radar screen trying to do this do not hire list as it relates to teachers, where we started this conversation. Sometimes it takes 2 or 3 sessions to get a bill done. We had it last time. We're going to try that again and really continue to work, as the governor said in this initiative, for victims of sexual assault and those kind of crimes is something we've worked very hard on, and I want to do it again. Any conversation about the legislature can't ignore property taxes and what a problem that is for people, especially in the fast-growing areas like we have here in Central Texas. And we've really got to address that. And I'm glad to see we're having conversations about public school financing as well. I think they are related. We need to focus on results in education, not just the dollars. We need to look at the output, not just the input. But property taxes are really hurting people, and we've got to get a grip on that.
All right, Tony Dale, thank you so much for being here. Always a pleasure.
Yeah, good to see you. Thanks.
You've heard how prescriptions for painkillers are helping to fuel an opioid epidemic across the country, but see why some parents fear the problem could be starting right in the pediatrician's office.
But sometimes when it comes from with our own team, I don't understand.
Sending a message why the lieutenant governor is calling out members of his own party right before a big election coming up. Lieutenant Governor Dan Patrick is sending a message to Texas Republicans less than a month before the March primary. Patrick was the keynote speaker at Thursday's Texas Public Policy Foundation event. He says the state's rainy day fund should not be used for ongoing expenses and will likely go toward Harvey relief. Patrick did not mention the bathroom bill, which failed last session, but he spoke harshly about divisions among Texas Republicans.
So when I hear people today who criticize the conservatives who have led this state for the last 15 years, it's one thing if they're on the other side, I get it. But sometimes when it comes from with our own team, I don't understand.
So far, the lieutenant governor has spent $5 million to run campaign ads across Texas. Patrick faces Scott Milder in the Republican primary. Milder is a businessman and civic leader from Rockwall. For Perspective, we're joined by Aman Bathija, the political editor for Texas Tribune, and James Berrigan, who covers politics for the Dallas Morning News. Welcome.
Thanks for having us.
So, you know, we've been talking a lot about the campaigns and the leading up to the primary. It seems like the governor and the lieutenant governor are supporting some people. What does that say when you have that type of leadership on your side?
Well, when you have it on your side, if you're an incumbent, it's kind of expected if the governor and lieutenant governor are members of the same party. But what we're seeing here is that they're going after they're supporting challengers of incumbents, and we haven't normally seen that, especially not this strongly. The 3 members of the House, Republican members of the House that Governor Abbott is trying to unseat in the primaries, all of them got crosswise with the governor on ethics legislation sometime during the last year. So that seems to be the main issue that's driving all of this.
And Sarah Davis and Lyle Larson were among the legislators who held that big press conference during the special session, asking the governor to put ethics reform on the special session agenda. Ultimately didn't go that way, but they kind of tried to send their own message that the House has its own agenda. And obviously that has not gone over well with the governor, who's campaigning pretty hard against them.
When you talk about the House having its own agenda, the leader, Joe Strauss, is not going to be there next year, decided not to run. Does that hurt people that want to go up against the governor if we do have a more conservative speaker?
It depends on who the next speaker is. There is a lot of assumptions that the next speaker will be more conservative than Joe Strauss, but, you know, at least historically, Democrats and Republicans have joined together to pick a speaker. So you're not likely to get someone on the far right. It's just, you may get someone more conservative than Joe Strauss, but maybe not that much more conservative. And if that's the case, then if some of these incumbents survive, they could still be in positions of power next session.
But we have seen changes to how the Republican caucus is going to try to pick the speaker. They're going to try to get on the same page to try to choose what I think you can only guess would be a more far-right speaker. And ultimately, if they do succeed in doing that, and in breaking that sort of coalition of Democrats and more moderate Republicans, then you may see a more conservative speaker, and then that might affect some of these legislators that we're talking about in terms of who's in leadership roles. You know, Sarah Davis is a chairwoman of the Ethics Commission, and that could come back to harm them. But first, she's got to get elected. So,
one of the big things the governor talked about this week was getting the Texas Rangers involved in investigating lawmakers that are accused of sexual assault and sexual harassment. How do you think that's being received?
I think it's a welcome start to a pretty big problem in the Capitol. The Tribune reported late last year, we found lots of cases of women who work at the Capitol telling us about times that they had been harassed by lawmakers or just people in positions of power over them, and they did not feel like they had anywhere to go to get proper recourse. So now the governor is saying the Texas Rangers is going to be another place that they can go to get this investigated, and that would be someone presumably kind of out of the political system, which could help the situation.
I think the whole rollout of this initiative is really interesting because it puts on the table tackling sort of the issues around sexual misconduct, around the Me Too campaigns. Then it puts on sexual assault kits, which has been an issue for a really long time. And so he is doing this move where the governor is trying to appeal to, I think, several different types of audiences, maybe trying to get some of the people on the Democratic side who he thinks he can attract, but then at the same time putting initiatives on that, or policies on that initiative that will also appeal to the base, such as human trafficking and then proper student-teacher relationships. So it's really interesting what he's trying to do there.
Great. Thank you both for being with us.
Thank you.
It's ridiculous. It's actually crazy. Why would anybody give a 12-year-old that much medicine?
High-power painkillers prescribed to children. KXAN investigates why the next wave of the deadly opioid crisis could start with your pediatrician. Central Texas doctors tell us there's a lot of pressure to make sure their patients are pain-free after basic surgeries. So much that places like Baylor Scott and White Health have designed specific training and systems to red flag doctors who are overprescribing painkillers, especially some of the most powerful. Opioid prescriptions are fueling an epidemic across the country. The CDC says prescriptions are behind 40% of all opioid overdose deaths. In 2016, more than 46 people died every day from overdoses involving prescription opioids. In 2014, almost 2 million Americans abused or were dependent on them. Now, KXAN viewers are telling our Arzo Dosed it's not just adults. Sometimes it's starting with your child's pediatrician.
Tumbling requires great balance and control.
She's aware mentally and very in tune to her body.
Gymnastics is this 12-year-old's life. She's no stranger to injury and the pain that follows.
She's my health nut.
So her parents were surprised when she was prescribed all this medication. We agreed not to reveal their identities to protect the child's privacy.
I really absolutely am not happy with the possibility of my daughter becoming addicted to an opioid.
In October, their daughter had her tonsils and adenoids removed. It's a pretty common problem which pediatricians come across daily.
Can you say, ah? Good job.
And it's a very common surgery. But it's what happened after that worries these parents.
It's more than 2 cups and it poured out the top.
This is how much hydrocodone with acetaminophen their daughter was prescribed.
And there's still some in each bottle.
They say they never received warnings the drug could be addictive.
It's ridiculous. It's actually crazy. Why would anybody give a 12-year-old that much medicine?
What's even more concerning, the parents say just 3 days after taking this medication, the middle schooler preferred it.
And she'd say, I need some pain medication. And I said, okay, we'll get you some Tylenol. She says, well, that works better.
We only gave it to her every other dose for a couple of days, and then we said, you know, this is a narcotic. We need to back off on it.
Do you think it was careless to prescribe that much medication?
Yes, but I do want to give a caveat. I just think it's standard procedure.
Doesn't mean that they wanted the child to have 3 cups. That just means that they wrote a prescription for a long period of time, hoping that they wouldn't have to hear from the parent again, ever, because that's a bother.
Dr. Ray Brown is the chair of the American Academy of Pediatrics.
Children die every year because of having been given opioids after tonsillectomies. To the extent that the American Academy of Pediatrics has come out strongly against the use of one specific drug, codeine, which is especially toxic in a group of children.
The state says in 2016, of Texas students in grades 7 to 12, 13% misused some kind of opioid. The majority of those cases, codeine cough syrup. Why isn't there better tracking when it comes to deaths and prescriptions?
That's a great question. And one of the things the committee we're going to look at is from the top down. The pharmaceutical manufacturer, what role do they play? The drug wholesaler, the prescribing physician.
As a 14-year-old, State Representative Kevin Roberts got his first job delivering prescriptions for a drugstore where he grew up. Now, he's part of a House committee scheduled to meet for the first time next month, trying to tackle the opioid epidemic and craft legislation for the next session.
And we're going to talk about prescribing patterns. We're going to talk about how can drug wholesalers better monitor inventory? How can a pharmacy benefit management company help with the number of day supply that goes to individuals? So on the front end, we can help prevent, hopefully, that addiction.
And what the Food and Drug Administration is now doing could help by increasing warning requirements on prescriptions with codeine. Before, the agency said the drug should not be used for any reason, even coughing, in children 12 and younger. Now, it's anyone 18 and younger. How much of the dosage did she end up taking?
I would say 10%. Maybe a little more than 10%, maybe 15%.
These parents wean their gymnast off the drug and say they want to be part of the voice for change.
I'm all for pain medication when you need it, but there's a time and a place, and making it become overused is just not setting the example we need to set for our kids. And it's not taking us in the direction that we need to reduce this kind of a problem.
Remember, that little girl was taking hydrocodone with acetaminophen, a combo that makes Vicodin. That's one of the most often prescribed opioids for children. Others that are common, Percocet and codeine. A lot of these are now flavored to taste better, but doctors say parents should not make it sound like their children are getting candy. That can give kids a false sense of the severity of these drugs. We took a closer look at the role pharmacists have in this important discussion. In the past year, they've filled 17.1 million opioid prescriptions statewide. For better oversight, the state's Board of Pharmacy is amping up the Texas Prescription Monitoring Program. It requires all pharmacies to report controlled substances like opioids within 24 hours of dispensing them. In fall 2019, pharmacists and prescribing doctors will also be required to look up that information in the system too. Dead animals, mounds of garbage, and gallons of black tar oozing out of this TxDOT dump site. Now state lawmakers respond to our investigation and look for answers from the man in charge of the agency. Rotting deer, mounds of garbage, gallons of black tar oozing out of this TxDOT dump site in Hays County, all uncovered in a 2-month KXAN undercover investigation. State lawmakers wanted assurance from TxDOT's executive director that his agency is not to blame for other sites across Texas. James Bass told House Transportation Committee members that he believes the problem is isolated. The panel wanted proof the animals and trash hauled away from that site were taken to a landfill. Bass replied he wants answers too.
TCEQ is on site and investigating that. Okay. We also have an internal investigation going on to find out, well, who knew and who was given that direction and whatever, and we will take appropriate action after both of those have completed.
The disappointing thing to me was not, it was that, yeah, it was done, but that somebody thought they could get away with it. Mm-hmm. And somebody on, they weren't afraid that for their job or that they were doing something inappropriate.
Within days of our investigation, TxDOT was out cleaning up the site. TCEQ tells us its environmental investigation could be finished up as soon as this week. You can see our full report in the investigation section of KXAN.com. Thank you again for joining us for State of Texas. I'm Josh Hinkle. Remember, you can catch us every Sunday morning on KXAN.